I have made the comparison between the prices in the US and the prices here in Cancun, and we are far below the prices in the US. More than 50% discounts if you compare the full price of the procedure there.
But spine surgery in Cancun isn't just about savings. Meet Dr. Raul, our expert neurosurgeon and spine specialist. He shares what makes this experience stand out.
I'm Dr. Raul Lopez Serna. I'm a neurosurgeon and spine surgeon. In my neurosurgical residency, I did it in Mexico City. Then I went to London to do a fellowship in complex spine surgery and guys at the Thomas Hospital. Then I did a master degree in Spain, in Sevilla, Spain. And then I came to Cancun and I had my practice here since 2013. So I've been working here in Cancun as a neurosurgeon and spine surgeon for 13 years so far. We basically perform any kind of neurosurgical and spine procedure, from a simple discectomy, microdiscectomy, endoscopic discectomy up to a tumor resection. So we perform from the simplest spinal procedures to the most complex ones, like tumor removals and lung fixation. We do ACDF, that's another very common procedure that we do. Anterior cervical discectomy infusion, we do disc replacements in the cervical area and in the lumbar area. We do facet infiltrations, nerve blocks. We have very high standards if we compare the level of care of Mexico and other countries. So basically, I don't notice any difference in terms of equipment or infrastructure here. We have a microscope, we have alarm, we have navigation. So all the equipments that I used to work was in other countries, I have them here. The hospitals are approved and are accredited by the Young Commission International. So there is a list of the best hospitals in Mexico. Feliz Hospital is usually within the first 10 in terms of quality of care. So they can be assured that they are getting the best of treatment here in Mexico. We can start a simple spinal procedure coming from $15,000. I cannot mention all the spectrum, but in more expensive surgeries, I have made the comparison between the prices in the US and the prices here in Cancun, and we are far below the prices in the US. More than 50% discounts if you compare the full price of the procedure there. So they're paying way less here. And in terms of the hardware that we use, in terms of the equipment we use, it's exactly the same procedure and the same hardware that they can get in the rigs. The screws, the cages, all the implants that we use in the spine, we use FDA approved with power here that comes basically from the US as well. As a matter of fact, I went to Chicago 1 month ago to the supplier infrastructure and we saw where they design the hardware we use here. So it's coming from Chicago. The disc herniation surgery is an ambulatory procedure. So the patient is admitted in the morning of the procedure. We do the procedure early in the morning, and by the afternoon he is discharged from the hospital. So after being discharged, we have this hotel that is next to the hospital. So the patient can get a room here and have the recovery period here that is next to the others. So we usually recommend at least 1 week at recovery in Cancun, and before going back to the country, you check the wound and everything. We have very good relationship with several teams of physical therapy, so the patient can be assured that after the surgery he can get the best care in terms of physical therapy and post-operative therapy as well. Once the patient leaves Cancun, they have all our contact details, so we can reach them via email, via Zoom meeting. I mean, if they want to come back here, they're free to come to the office, but there are several ways to contact us after the procedure.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.